Okay, so my name is Sarah Sweeney, and I'm Policy and Communications Manager at Families and Travellers. We're a national charity that works on behalf of Gypsy, Roma and Traveller communities. And we organised today's webinar just to bring people together, just to take a particular focus on populations at the sharp edge of inequality. So thank you so much for coming along. We were overwhelmed and a bit shocked and surprised to see so many people who were interested. So there should hopefully be around 300 people who've signed up, and we anticipate that a good deal of people will join the call. And for us, that felt really encouraging to see that there's so many people interested in this topic, and we hope also keen to take action on the ground as well. Just by way of housekeeping, we just ask participants just to stay on mute throughout the call. Just as there's so many of us, it might get a bit overwhelming. Otherwise, it might feel like a family get together at my house, which is lots of people speaking, but not many people listening in the end. So if you want to pop yourself on mute for now and pop any comments, questions, anything in the chat box throughout. If you are dialing in by phone, I think the majority of people probably, it looks like, have dialed in through their laptop or through computer. But if you're dialing in by phone and you'd like to raise a comment or you have any questions, please feel free to email my colleague Sammy. He'll be working as quick as possible, just kind of copy and paste his messages across into the chat section. So that's Sammy at gypsy-traveller.org, and Sammy spelled with an I, so SAMI at gypsy-traveller.org. If you're having any major technical difficulties, this is the first webinar we've held of this size, so we'll do our best to help you. We can't guarantee anything. We will be running other future webinars if you find it hard to access this one. But if you're facing anything where you think there's a technical difficulty that we might be able to help with, equally you can drop Simon an email and we'll do our best to sort that out. And we do plan to record this webinar, so if there's any reason at all that you'd prefer us not to put that recording out, or sections of that recording out as well, then please just let us know by the end of today, and we won't release that publicly anywhere if anyone at all feels uncomfortable with that, so just let us know. So just as an introduction to the session, so as we all know, then coronavirus has definitely highlighted pre-existing inequalities in society. The topic of today's webinar is supporting communities at the sharp edge of inequality during coronavirus. And a term that we use for these communities in health policy and planning is inclusion health groups. And these are the populations identified as experiencing the worst health inequalities in the UK. This includes Gypsy, Roma and Traveller communities, people experiencing homelessness, vulnerable migrants, refugees and asylum seekers, people in contact with the criminal justice system, sex workers and more. Now you might be looking at this list and wondering what the communities have in common. And it's not just that people would naturally group themselves in this way, of course. So for us, it's helpful to look at this through the lens of health inequalities. The definition that NHS England uses of health inequalities is that health inequalities are unfair and avoidable differences in health across the population and between different groups within society. And health inequalities arise because of the conditions in which we're born, that we grow, we live, work and age. Inclusion health groups are at greater risk of experiencing extremely poor health before coronavirus. And this includes shorter life expectancy, less years spent in good health as a result of poverty, marginalisation, multimorbidity and social exclusion. Now, the reasons vary by group, but they can include the effects of stigmatisation and discrimination, the impact of chaotic lifestyles, which are often outside of an individual's control, low health aspirations, the complex nature of health systems, and the effects of the wider determinants of health. As a result of pre-existing health inequalities combined with chronic exclusion across the wider determinants of health, members of inclusion health groups are at higher risk of being infected by coronavirus, but at greater risk at greater risk of severe outcomes as a result of contracting coronavirus. At Friends, Families and Travellers, we're a member of it's called the VCSE Health and Wellbeing Alliance, which is a partnership between the voluntary sector and the health and care system, and its aim is to provide a voice and improve the health and wellbeing for all communities. The Alliance is jointly managed by the Department of Health and Social Care, Public Health England, NHS England and NHS Improvement, and is made up of 20 voluntary sector members that represent communities who have shared protected characteristics or that experience health inequalities. And as part of our work on the Alliance, we work closely with other organisations who are working on behalf of specific inclusion health groups. And what we find is that although every community and every individual is different, the ways in which systems and services are often unwittingly excluding or overlooking the needs of inclusion health groups often have overlaps. We hope that today's webinar will help to equip you with information and inspiration, hopefully, that you need to begin or continue your work on tackling health inequalities for those at the sharp edge of inequality. We have speakers today from Leadsgate speaking about Gypsy and Traveller communities, from Roma Support Group speaking about Roma communities, from Doctors of the World speaking about vulnerable refugees, migrants and asylum seekers, and from National Ugly Mugs speaking about sex workers. So each speaker will have 10 minutes to speak, and then we'll move into a Q&A session. So there should be about 15 minutes towards the end that we can all put forward questions and hear some answers as well. So without further ado, I'll pass you over to Charlotte James, who's Health Coordinator at Leadsgate. We should be speaking about Gypsy and Traveller communities. Leadsgate, which is short for Leeds Gypsy and Traveller Exchange, is an award-winning membership organisation for Gypsies and Travellers in West Yorkshire. So I'll pass over to you now, Charlotte.
Hello everybody, nice to see you all. So I'm just going to be telling you a little bit about how we've been supporting the Gypsy and Traveller community over the last few months. So we've been working on a need basis of our members. So we've been, at the beginning, we thought about what would be the best way for our team to support the Gypsy and Traveller community. So we've done this in various ways. We mostly, and still ongoing now, have been carrying out welfare calls to our vulnerable members, which has seen very good response, which has made more secured relationships with members that we didn't always speak to. And we're excited to see what comes up from these made relationships through these welfare calls. We've also supported our roadside members that were living roadside, didn't have a permanent address, usually get moved on from camp to camp from 2 to 3 weeks stopping. We managed to secure extra stopping for up to 3 months, I think it was. We managed to secure some showers and toilets on the camp. Sorry about that. That were getting cleaned regularly from previously 2 weeks to 1 week, which was a very good outcome, seeing as we've seen that these members were the most vulnerable during the COVID time with no permanent address. We've worked really closely with Leeds City Council that were also taking down water regularly, so that's been a really good outcome. We've also been working with 100% digital leads, realising that our members were digitally excluded, which was causing obviously a lot of exclusion and resulting in inequality because they were unable to access doctors' online appointments. Everything moved to online, which was obviously excluding members who didn't have Wi-Fi. We realised that Wi-Fi was hard to secure on Gypsy camps. So we've managed to secure 10 Wi-Fi boxes and some laptops that we are going to be handing out into the community to where we'll best see them fit. So that's a new exciting thing that we've managed to secure. We've also got a lot of Gypsy and Travellers that are self-employed. So recognising this as the weeks go on, families were struggling more and more. We put together a scheme for vouchers for families that were affected, who were self-employed. So this has been a really good thing that we've managed to secure for the Gypsy and Travellers, and something that's been really in need for. We've also been running mental health campaigns throughout, trying to motivate people through Facebook, getting people more active. Tyson Fury has been someone that's been really popular among the community because obviously he was doing a live workout every morning. I don't know if any of you were aware of that. We're getting a really big following, so we've had some really good response from that. We've also been making sure that members were up to date with the government guidelines. So obviously some weeks the guidelines were confusing. So we've been putting together a document every week that we've been putting out on Facebook. Also ringing people, explaining to our vulnerable members what the guidelines were, also through WhatsApp broadcasts, making sure that people were understanding some of the clear guidelines, just the vital information. A lot of people were confused about that. So we've had some really good response from members who explained that they feel more up to date and aware of the guidelines through the welfare calls and the Facebook posts that we've been putting out regular. We've run campaigns with our youth team for the youth members that have been working weekly with the youth members to obviously keep them motivated, keep them up to date with the guidelines, and running weekly tasks to try and keep the mental health motivated and the physical health. So we've been running like mini campaigns of tasks that involve competitions and rewards. And then over the last couple of weeks, we've been running some campaigns where members have been getting involved to try and get them thinking towards like after COVID. So getting involved with tasks, which means that there's some rewards or there's some events that'll be going on after, just to try and get people thinking forward, because we felt after a few months now, it's like an ongoing thing. We need to be thinking forward. People need to be thinking that things are gonna change and hopefully go back to normal. So that's been one of the key aspects we've been focusing on over the last couple of weeks. And I think covered quite a lot there about what we've been doing. So we're going to leave questions to the end, did you say, Sarah?
Yes, that's the plan.
I hope that some of the things that I've mentioned have been interesting, and yeah, open to any questions that you might want further information on.
Fab. Thank you very much, Charlotte. That's really helpful, and thanks for getting the session kicked off there. So next we're going to pass over to Mihai Bika, who is campaigning and policy worker at Roma Support Group, speaking about Roma communities. Since 1998, the Roma Support Group have worked with thousands of Roma families to improve the quality of life for Roma refugees and migrants in the UK by helping them to overcome prejudice, isolation and vulnerability. So Mihai, I'm just going to pass this over to you now.
Great. Thank you very much, Sarah, and thank you very much everyone for joining us today. I'm going to start a bit with some background regarding Roma Support Group and the community here in the UK, and then we'll move on into some of the issues that we have been facing through this crisis, and we'll end up with some maybe, let's say, recommendations for services regarding what they should do to better support the Roma communities in their area. So the Roma Support Group is a charity with nearly 22 years experience in supporting the Roma communities across the UK, being the first and the biggest Roma-led charity today. Official data based on a Salford University research back in 2013 indicates that we have about 200,000 Roma living in the UK. But estimates indicate a far greater number across the country. This is, due to increased levels of migration in the recent years, coming from Eastern European countries, and not only. Most Roma in the UK moved here from Eastern European countries like Poland, Slovakia, Romania, Bulgaria, Hungary, and many other countries, including Black Roma from African countries. This means that we have a very diverse Roma community, speaking many different languages and many different dialects of Romanes, the language of the Roma people, which is a oral language, so therefore not a written one. Unfortunately, due to long history of discrimination and centuries of negligence by governments, the Roma community records now a high level of illiteracy, a high level of people working in precarious conditions due to limited access to education, worrying health outcomes with 7 to 20 few years of life, and a much steeper increase in chronic disease for those over 65. 70% of those over 65 experience more serious health situation, comparing to 56 for the non-Roma population. And this is due to lack of health education and poor housing situation, both in the countries of origin, but unfortunately in many situations here in the UK as well. And we've also seen there is a huge lack of access to mainstream information. This means that the Roma community in the UK has now low levels of education, works in low-paid, insecure jobs, lives in poor, often overcrowded housing, and have their right to access welfare and support conditioned by their migration status. Now, COVID-19 has hit pretty hard the Roma community. In April and May, we have seen a spike of COVID-19 cases, including deaths in our community. The Roma had no access to appropriate information on COVID-19 guidance in the UK. In the same time, many were asked to continue going to work by factories, food processing companies, and farming. In addition to not having access to information on social distancing and government support available, this has basically exposed them and their families to the virus. Many Roma were not able to access the support available due to lack of information and support. The Universal Credit and Self-Employment Income Support Scheme were only available online, and support to access those particular services was extremely limited. Many could not access the food banks, for example, due to difficulties related to referral systems around that. And we've also seen many Roma who did not seek medical help for non-COVID-19 related issues, as they were not registered with the GP earlier, because in some cases they were not able to provide a proof of address, for example. Many became fearful of the virus spread after they had experiences in their families or communities. Many distrust medical staff. This is mainly related to negative experience in the country of origin. Also, we've seen that there was quite a huge spread of fake news. For example, the Slovak Roma community heard that children will be removed from families with COVID-19 cases. We've seen in the Romanian Roma family many people saying that if they will access health support, health services, there might be a chip implanted through some vaccine or different sort of medication for COVID-19. And we've also heard stories from people saying that their immigration status was questioned while in hospital with COVID-19, and this information has spread, quite a lot in some communities who then didn't want to access health services. We've also seen that many Roma were not able to submit EU settlement scheme applications, and this is to secure their right to remain in the UK after the Brexit. From our experience, we've seen that only 3% of Roma are able to complete an online application completely independent. And because of COVID-19, face-to-face interaction totally stopped, and Roma lost all access to the support available. More than that, all embassies were closed, and all those with expired documents could not renew them in order to make a new application. We've also seen that vast majority of Roma children missed education. From our experience, about 20% of Roma children do not have equipment needed to access online learning facilities. And in the same time, many of their parents do not have the skills needed to support them with home education. We've also seen problems with many Roma sleeping rough who could not access the accommodation provided by local authorities, as there is historical distrust in the outreach teams and in the services provided to those sleeping rough. Most of the concerns we have regarding that are around how the information was delivered and how people were explained about what is going to happen in the accommodation that they are being provided. As many Roma sleeping rough do not speak English, and I've already mentioned the historical negative engagement with the outreach team. Now, in order to address some of these issues, we urge all services and authorities to identify if there is a local community in their area. We admit this might be difficult because many Roma do not disclose their ethnic identity due to fear of discrimination. But this can be done with support from a trusted person and by promoting Roma culture and history. Local authorities should make efforts to ensure that the information on support available reaches the Roma community in their area, and that support is available for those in need. This includes information on universal credit, or financial support from the government, EU settlement scheme, and this information should be accessible, should be in a way that people understand and through channels that people trust. And local authorities also should make access to food banks easier for those who don't speak or write English and those who don't normally engage with local charities that can refer people to food banks. Most Roma are working long hours in factories, and this is the first time they ever engage with such entities. And in the same time, local authorities should make efforts to support those sleeping rough. Also, we think that public health should identify, work, and resource trusted members of the community in order to ensure that COVID-19 guidelines are translated in languages accessible to the community and reaches the community through trusted channels. We'll also like to see efforts from health services such as GPs to ensure that they can rebuild the trust in the community and support people who were not able to register with a GP so far, support them to do that. And also work on fighting a sort of negative and fake news that is out there today. And also any other organizations and charities here should try and make efforts to provide support to the Roma in their area and try to find out if there is, for example, a Roma charity around who is working hard to support Roma and support that particular charity, because in most of the cases, these charities are basically 2 or 3 people who mainly work voluntarily with very limited funding, and they would definitely benefit greatly of such support. Now, I think to conclude this, we would like to see support being provided to local charities that are working with Roma in different areas of the country. Support meaning maybe resourcing these charities, including them at the communications table to make sure that they have the right resources to support the Roma beneficiaries. Also, we'd like to see an engagement with trusted Roma across the country and obviously trusted Roma charities in order to regain and rebuild the trust in the Roma community to access support and services available. And we would like to see that all the whatever information, relevant information, is being released by local authorities, public health or other services. We like to see that information being available for those who don't speak English, those who are illiterate, and those who can't access online information. And when doing that, we recommend that should be done through people that are trusted by the community, either Roma and non-Roma. There are charities who are working very well with Roma communities and have a really strong relation and based on trust with people in their areas, which is working very well. But in many cases, these people don't have the right resources to provide that support. So all the services here available try to make efforts to make sure that the Roma are being supported in the future. So I think that was all from my side. I hope I didn't jump too much over my time.
No, that was perfectly high. Thank you very
Thank you
much.
very
Really
much, Sarah.
appreciate that. It's interesting to see that there are definitely, while each of the groups are distinct and different, there are some commonalities there. I think there's this fear around access to healthcare in a time when services have adapted more to digital. And also I think it's that the pre-existing issues that were existing in the health service, but lots of public services around communicating with diverse communities, whether that's people with low literacy or people experiencing digital exclusion or people who don't speak English as their first language as well, then this really exacerbates that issue when we can't see each other face to face as much too. So there is a real challenge on all of our hands across all services to be looking at those things over the next while. Next I'll pass over to Ella Johnson, who's Senior Policy and Advocacy Officer and Outreach Lead at Doctors of the World. Ella's going to be speaking about vulnerable refugees, migrants and asylum seekers during coronavirus. Doctors of the World Network has more than 400 programmes in over 80 countries, whether it's providing urgent medical care in Ukraine, giving mental health care to refugees in Calais, or strengthening health systems in West Africa. Doctors of the World meet the needs of vulnerable communities locally. In the UK, Doctors of the World run a clinic and advocacy programmes in London that provide medical care, information and practical support to excluded people such as destitute migrants, sex workers and people with no fixed address. And I'll just hand over to you now. Thank you.
Oh, thank you very much, Sarah, and thank you very much for having us here today. As Sarah said, my name's Ella. I'm a UK Policy and Advocacy Officer with Doctors of the World, working in the policy team on the healthcare access issues that prevent people who face exclusion from accessing health services. But I also am one of the mobile clinic coordinators. So in a non-pandemic setting, I'm one of the coordinators and drivers of the mobile clinic van that we have in London. But we haven't been able to take that up for some time, although we are doing street outreach instead, just without the unit because it's quite an enclosed space. So today I will talk to you mostly about the findings of a rapid needs assessment that we conducted at the beginning of the outbreak to look into the impact of coronavirus for groups who ordinarily experience exclusion from health services. So typically the patient group that we serve in East London are largely undocumented migrants. We see around 2,000 people a year, and the vast majority of them are undocumented or irregular migrants, or however they choose to be identified. So it's not typically people who are seeking asylum and people who are refugees, although we do see some asylum seekers and refugees in the clinic. And we also increasingly see a large population of people who are experiencing homelessness. So for the purpose of the needs assessment, we were looking to look at what the pandemic means for somebody, not only the pandemic and the virus itself, but also the control measures that are implemented to control the virus, such as the lockdown, and how that impacts people who already experience a distance between themselves and health services. So the scope grew a lot actually from the group of patients that we ordinarily see. So whilst we did speak to people who were undocumented migrants, we also spoke to people seeking asylum and unaccompanied, and people who support unaccompanied asylum seeking children, refused asylum seekers, people recently released from immigration detention, people affected by or survivors of trafficking or modern slavery, people experiencing homelessness, Gypsy, Roma and Traveller community, sex workers, and people recently released from prison. And we collected our data in the last 2 weeks of April, and we published the needs assessment, I think it was around the 20th of May. We conducted 28 semi-structured interviews and focus groups with 14 participants. We took testimonies and we also surveyed 22 participants. And 21 people that responded to the needs assessment and had an interview or submitted their experience in some way had lived experience of health exclusion. And we tried to have a broad reach, so it wasn't particularly London focused. We did reach a lot of people who were living in London, but also beyond, a lot of people in Leeds and West Yorkshire, Birmingham and the West Midlands, and some in the North East as well. So when we looked at the issues that were facing people who experience exclusion from health services, and as Sarah said, I'll try and focus a little bit more on the experience of asylum seekers and refugees and migrants, but actually what we found was that the responses that came back from all of the communities listed above were quite universal in terms of if you face exclusion from health services, regardless of which population you belong to, you are likely to encounter the same barriers in a pandemic setting. And the overarching one was digital exclusion, which I know we've heard about already today, and I'll come back to. But to begin with, two of the really overarching things that people reported was issues accessing public health guidance that they needed to keep safe. So not knowing what to do if they felt that they had coronavirus symptoms. You know, a lot of people had heard of coronavirus, but perhaps they were a bit less sure about what to do if they felt that they had symptoms. And then also, if they had access to the guidance, it was in a format or a language that they could understand and was appropriate, then they weren't able to realistically follow the guidance. And access issues really were for a lot of reasons. People were unable to access information if it was online. There were a lot of language and literacy barriers to reading guidance. Guidance wasn't public health thing that didn't translate the guidance very quickly. Doctors of the World, so some of my colleagues in the policy team, they started working on translating the guidance quite soon into the pandemic, and I think we've got around 60 languages now, growing. There was also an absence of or delay in developing inclusive guidance, and then this guidance not being disseminated through the appropriate channels. So looking at where people who experience exclusion go to for their information, is there an opportunity to disseminate coronavirus pandemic guidance via those channels? A quote from one of the asylum seekers that we spoke to, he said, "As asylum seekers, the first thing we felt was left out by the government. I know the government is facing crazy moments, but being a leader of a country facing coronavirus, it's not just about thinking about citizens and residents, it's about all human beings that live in the UK." And we really heard about the closure of some support services, really compounding the issue of access to information, because a lot of people that we spoke to would ordinarily get their information from voluntary services. So that was really a knock-on effect of the fact that the guidance wasn't really available, and if it was, the place that they might go to receive that guidance wasn't open anymore. There were a lot of issues following the guidance, so accommodation-related barriers, people who lived in shared accommodation or who had limited control over who they lived with. One lady we spoke to said, "How is it possible to self-isolate in a shared house with 3 mums and 6 children where you share a toilet and a bathroom? If we have to self-isolate, there is no way of us getting food." And similar things coming out of accommodation with communal facilities, overcrowding, lack of access to facilities, and living in confinement as well. And then also the need to go outside. It's all, lockdown, isn't compatible with certain livelihood strategies that people need to go outside to access food, to manage addiction, to obtain income. And one asylum seeker summed it up really well when he said, "How as an asylum seeker can you avoid going out? We don't even have a bank account to do the shopping online. The bank card we have, it's not permitted to use online. And we don't have enough money. And sometimes we don't buy in one place, we buy in different places. So it's really complicated." So this idea that if you've only got a very small amount of money to live on per week, you might be somebody that needs to travel further to find affordable products and go to more than one shop in order to get the most out of your limited budget, which is just quite a nuance it's not really compatible with the guidance around only necessary journeys and so on. So, despite all of this issues accessing information and guidance, there's also excluded groups found were likely to be at an increased risk of ill health directly from COVID-19 and physical and mental ill health indirectly from COVID-19 lockdown measures, and yet were more likely to experience difficulty accessing healthcare. So it came as no surprise to us at Doctors of the World, because a lot of the work that we do is advocating around primary care access, so to put an end to this culture where you must produce your ID and your address in order to access primary care, because NHS England guidance certainly doesn't insist that you should. So it shouldn't be a barrier, and yet it is all too common. So yes, difficulties with the GP registration came up. A lot of practices saying we're simply closing our list because we're in the middle of a pandemic. But also fear and lack of trust because of previous experience with health services where people had experienced stigmatisation or discrimination. And of course, NHS charging. So people who are not ordinarily resident, that's the test that overseas visitors managers in NHS trusts apply when they're trying to ascertain who should be paying for their secondary care treatment. if someone is found to be not ordinarily resident, then they are charged for their healthcare. And although COVID-19 is exempt from charging, people may present with COVID-19 with a variety of symptoms. People are not always sure that their symptoms are related to COVID-19. And if they're found to not have COVID-19 and they're not ordinarily resident, then they are liable for charging. And there's not a great deal of public information campaigns for NHS staff in secondary care settings or primary care settings, or people who are affected by the charging regulations, to let them know that COVID-19 they won't be charged for their care. So as one colleague said, the NHS has spent 6 years sending letters to people and saying that you're not entitled to NHS care, and they're going to be reported to the Home Office if they incur any debt. And that's worked. That fear is there in these communities, and you can't just turn that fear off now when you want people to come forward. Our patients have a very good idea that the NHS services are not for them. So charging came up as a real barrier. And then, of course, digital exclusion. So excluded groups are more likely to be affected by the change in the way that services are adapting. So this was the theme that was presented by all groups that we spoke to. Phone consultations aren't appropriate or available to many with limited financial means who have to choose between phone credit, food and transport. We spoke to people who ran out of credit just on hold to a GP reception, so then the idea of them having a phone consultation was also not possible. I'm just looking at the time, so I'll just move on to what I would have, I think, wrapped up with, which is around what we recommended and what we would recommend following the needs assessment. So there are actually 12 recommendations, but I won't go through them all. But particularly on guidance and access to guidance, we call on the government and Public Health England to establish a rapid translation hub to consult with expert representatives in the development of guidance to ensure it's accessible to those without English as a first language or with limited literacy skills, and then to disseminate this guidance proactively through trusted sources. Because if you can't access gov.uk, then you need to be receiving that information by other means. And number 2, around digital exclusion, to prioritise reallocating resources to prioritise people who have issues accessing technology. So that was a recommendation that we made to CVS organisations. But also to provide on the government, local authorities and asylum accommodation providers to provide free access to Wi-Fi within places that accommodate people living in vulnerable circumstances, as well as increasing asylum support rates in line with mainstream income support levels to enable people to purchase credit and mobile phone data. So in terms of the top 3 tips for services, I think number 1 would just to be aware of NHS England access and entitlement policies and ensure all staff and clients are up to speed. People should not be being told they can't register with a GP because the pandemic is happening, or they don't have their passport, or they don't have proof of address. Treatment and testing for coronavirus is free. People should be going forwards if they're feeling like they may have coronavirus. So it's just to make sure everyone knows that, because there's a lot of misunderstanding around that, because we have such a culture of producing our ID at every juncture now in society that a lot of people are deterred for that reason. And then it's just thinking about adapting services. This was something that we were recommended for primary care and for voluntary sector, around looking at those who will struggle to, if your service adapts to have an online presence, who does that leave out amongst your service user group, and are there any creative things that can be done to implement a solution to that? I think I better stop there because I think I've spoken, but I'll stay around if anyone's at the end.
That was really helpful, Ella. Thank you very much. And I can see definitely in some of the things that you've mentioned are things that we've seen as well, working with families who are living roadside at the moment, or during, especially the height of lockdown. It felt kind of farcical at times to say to people, can you stay 2 meters away? Can you have separate bathrooms and things, when some people were struggling to access bathrooms at all, or access basic water and keep distance. So sometimes it can create more fear than assurance if there's all these public health guidance out there that you're meant to be following to keep safe, and actually it's really difficult to follow those, trying to find those adaptations and ways of working and making sure that people have the support they need during really critical times. And of course health services have to be part of that picture. We know that Doctors of the World have done a lot of work around access to general practice just last year we did a mystery shopper sales at FFT of 50 GPs, and we found that 24 turned away our mystery shopper and saying they couldn't register there, which is against NHS signaling guidelines, either because she didn't have a fixed address because she was living roadside, or she didn't have an ID, and we know that people within our services are less likely to have proof of identification. So all of these things that people don't realise, perhaps sometimes the impact of the things they're saying or the rules they're putting in place. So just having those really thorough reviews and forward planning, looking for potential causes of inequality, and the same would be the case for the test and trace approach. How do we ensure and support everyone from all communities to access that? It's important for all of our health. Next, I'll just pass on to we've got Jason Domino, who is part of the research and development team at National Ugly Mugs, or NUM. Jason is also speaking from personal experience as a sex worker and acts as lead on sexual health and wellbeing for UCAP, which is UK Adult Professionals Porn Union. Jason is joined by Kat, also from National Ugly Mugs. NUM is a pioneering national organisation which provides greater access to justice and protection for sex workers who are often targeted by dangerous individuals but are frequently reluctant to report these incidents to the police. And I'll pass over now to Jason and to Kat.
Thank you very much. I'm going to try and set up my screen for one moment. Okay. Hopefully this should all work. Okay, can you all see, is the screen working okay?
Yeah.
Yep, oh good, thank you. Sorry, I'm just double checking with that. So hi everyone, I'm Jason Domino. So thank you for the introduction. Yeah, my background's in the porn industry as a male sex worker, seeing clients one-on-one, also in the sort of porn union and the National Ugly Mugs side of things. And Kat, are you with there? I'm just checking.
Sorry, yeah, I'm with you, yeah.
Okay, I'll let you do a little intro and then we'll skip into the first one.
Yep, so I'm Kat from National Ugly Mugs, and I will be talking through this with Jason today.
Right, okay, so the first issue which we're seeing sex workers have been encountering during COVID-19 crisis has been the existing barriers that have been there for sort of generating income and keeping on top of rent have become so much more complex. I mean, there's far fewer clients available, and sometimes that's meaning that the sex workers are reducing their prices in order to get access to those clients, and there's sort of the competition which is changing that way. At the same time, although there's less clients, there's still a large number of them who are still being aggressors and potentially dangerous clients, so you're taking higher risks in that capacity. Also, there's things like fear of police interaction around COVID-related issues that are meaning people are more worried about, potentially being caught on the street or however they're sex working, and so all of that can kind of have an impact on how much money you're bringing in at the end of the day. And then the setups with people having their accommodation, large number of people in sex work feel like maybe having a semi-arranged rent. So maybe the landlord knows what they're doing and it's a sublet, something like that can be an issue. And so maybe there's less protections in place for sort of protecting against evictions because it's a very informal sort of process without a tenancy agreement, these sorts of things. So people are really worried now about being somewhere stable and being somewhere homeless. That's the sort of situation with parallels with brothels being closed, strip clubs being closed, and again, the fact that things like childcare, food, and rent is continuing in a lot of these setups. I'm going to hand over to Kat.
Yeah, so kind of just following on from that really with the loss of income, one of the biggest issues that we've seen National Ugly Mugs and sex workers in general seem to be experiencing is the exclusion from a lot of the financial aid that's available. While people in other sectors might have applied for things like universal credit, business support, or been furloughed, brothels kind of obviously aren't furloughing their staff. And there's been a lot of issues surrounding that, especially with some of the more marginalised sex workers who might not have the access to the internet or a stable phone number to apply for benefits. They might struggle with, there's issues with the English in applying for them, and even more so for people with uncertain immigration or working status. Usually you would have the drop-ins and the outreach services that would be able to help support people who needed any extra help, but at the moment they're not available, and sex workers are finding it extremely hard to get in touch with any financial aid, which is forcing people to take risks and continue working.
One of the next big issues that we're talking about is the community and the connection to the wider communities. So sex workers, we classically can already have issues with separation and stigma between like the community around us. Sometimes we're rejected by family, sometimes friends treat us differently because of the work that we do in and around our community. There can be like large levels of prejudice keeping us, which have some impacts on our mental health. But with the fact that now sort of sex workers to a large level have been left out of the national debate with regards to who gets support, who doesn't, it's another further level of erasure of the community. Even though the community have been fighting hard to support one another, it's again this sort of like, these people don't exist. And that again makes individuals feel a lot more isolated, a lot more alone, a lot more of the sort of well-being impacts which come with this sort of situation, social isolation. It also has an impact as services have become sort of adjusting with what's been happening. So there's been reductions with peer-to-peer sort of meeting and the sort of support that's available there. We've been trying to grow with that as far as there's other communities that are sex worker sort of communities, and they've been trying to put on events and online event reactions, but at the same time they're saying a large increase of vitriol against sex workers, saying things like, "Why I've seen this sex worker still working during COVID," playing into like long-term sort of stigmas of like vector of disease sort of conversations, as opposed to realizing that sex workers aren't being offered adequate support that's available there. And now there's a lot more competition for them clients. If they're working online, there can be barriers there. Not everyone's eligible. Like not eligible. Not everyone is comfortable working in that sort of way. It's not a simple shift to just work online, and there's sort of attacks against online work currently anyway. So yeah, I'm gonna for you, Kat.
Yeah, so one of the things that's really linked to this is the impact of COVID-19 on sex workers' mental health. As Jason's just mentioned, it's extending the stigma towards sex workers massively. There's a lot of stuff about people passing on diseases. There's some quite unpleasant things happening on social media and the media in general. But the other side of this is we recently had a survey on our response to COVID at National Ugly Mugs. And one of the things mentioned was the lack of mental health services and sexual health services that are available for sex workers. With the isolation, mental health services have been highlighted as something that is important for some sex workers. And as well as that, there's been issues with sexual health we've had PrEP treatment has been stopped in some areas. Some sex workers are unsure really where they can get any treatment for any pre-existing issues or sexual health testing.
Okay. Yeah. So in response to these situations, the community is sort of pulled together. But again, as we mentioned before, some of that goes a little bit unnoticed. But things like our surveys have identified a bunch of these issues. But in response to these problems, there's been things like the Swarm Hardship Fund, which is sort of a donation group which is giving out sex workers, giving funds to sex workers who are sort of falling between the cracks in support that's available there. The Swarm offers one of these. Umbrella Lane offers one of these as well. Do contact NUM if you need to sort of recommend these different pathways to people, because some of these are currently sort of overwhelmed with requests at the moment. So it's worth having a bit there, and also NUM might be able to arrange some other types of support. So that's some of the actions that are going on currently. And with accommodation, again, some of the classic components, but we're starting to see some bureaucracy leak back in again with getting people housed.
Yeah, one of the things of this as well, with other things that you can do as well as the hardship funds, are if you do know anyone from the community who is really struggling with this, if you can direct them either to the standard kind of things, but also for things like how sex workers and COVID are working at the moment. The research and development team at National Ugly Mugs have recently made a webinar, which we can probably share the link to if you have any sex workers who are interested in this. And as well as that, organisations like Swarm, which Jason has just mentioned, are now offering some classes, I believe, in kind of accessing financial aid, accessing services that sex workers are traditionally experiencing very large barriers to accessing. Our caseworkers are available for sex workers as well who are struggling during the pandemic, and they are doing that in addition to their usual casework. And it's just really a case with sex workers of either signposting or assisting to access services that traditionally sex workers do struggle with.
I'm going to post the link into the webinar that the R&D team made, but I'm going to have to do that after I finish presenting. So keep an eye on your on the chat for people that are joining that way. For people that are on the phone, I'm going to read out the link real quick. We made a tiny link, so that's tinyurl.com/Y7DE9BAX, and that will link you straight through to the webinar, which is specifically for sex workers coping with COVID-19, going through some of the different financial support systems that are available for them. Okay, so with some of the vitriol, do be aware that again, people, it's a really important issue to be able to combat and notice when that vitriol against sex workers is happening, when it's connected to COVID-19 and saying that sex workers are, are sort of spreading agents of all of this, because there's just so much going on at the moment with all of this. So if you can signpost sex workers to organizations like Swarm, ICRC, ECP, Umbrella Lane, Sway, whatever's available, or get in touch with NUM, and we'll be able to put some recommendations forward of who their local projects are for the sex workers if they're needing.
Yep, and again, kind of for other services very similarly, if you are still working during COVID-19, especially if you offer outreach or drop-in for sex workers or services that are likely to have sex workers using the services, just explaining what's still on offer. I know a lot of services are either shut down or offering reduced services. So for example, if you're offering post or STI testing, if possible, sometimes sex workers are finding it quite hard to access these. We've had a couple of members of National Ugly Mugs who haven't been able to find how to get an STI test, and then not stopping working because of their own financial situation. So accessing things like PEP if needed, also harm reduction measures, if possible, clear communication is extremely helpful for sex workers at the moment, especially if they are still working or in financial difficulty.
Okay, I know that we're running out of time already, but I'll try and bring us to a close in a second. So we're going to leave you with some top 3 tips for being able to support sex workers at the moment. Consider your engagement and consider support with sex workers as a marginalised community as one of the sort of professional obligations as a community, rather than sometimes people just think of it as a profession sort of standalone. Look at what the services are needed right now. Look at how sometimes people have attitudes that if you squeeze sex workers in a hard time, they're more likely to change their sort of job. Whereas the sort of reactions by sex workers, and we can see that directly, is when we're going through a hard time, we're more likely to rely on what we know rather than take risks of trying to change our profession. So a hard time on sex workers doesn't mean we're going to shift to something else. If we're comfortable and feel like we're able to have no stigma when trying new options, then we feel like we're able to eligibly try other types of work. So yeah, be conscious of that. Kat?
Yep, so I think the only other thing I'd probably bring up on these top tips is going to be the basically during COVID is developing connections with other services. There's a lot of distrust from sex workers with either support services, health services, social services, usually due to bad experiences and things. So during this time, it would be great if you do need to connect them to other services, if it can be done in a sensitive way, and also just respecting sex worker autonomy for them to let you know if they need help. Not all sex workers are going to need help, extra help at the moment, but if they do, it's important to be clear on what's available. The only other thing to consider on this is, with that, just letting them know what is open, what's not open, and what you can possibly signpost or assist with at the time.
And the last tip to make is, even if you are doing some great things to support sex workers during this time and in the past or subsequently, all of these, be aware that there is a real division at the moment of who we're trusting and who we're not trusting. So there's one key component which sort of helps us understand whether you're for us as individuals, and that's whether your organization is standing up consistently and proactively for the decriminalization of sex work. So when it comes to the decriminalization of sex work, it doesn't mean necessarily that if you're being pro-decrim that you're pro-sex work. It's just an attitude of recognizing harm reduction with decriminalization, and how things like it could reduce things like COVID transmissions, as you look at areas like New Zealand, where support has been a lot more available to sex workers because of the legal status of sex work, recognized as not a law, not breaking the law type of work. And if you want to find out more about that, then have a look at decrimnow.org.uk. You can go into full explanations. But remember that barrier of trust actually impacts how many sex workers come to your service. And it's something that you need to consistently be doing, because people are not always in sex work for a huge amount of time and may not know your stance. So it's actually something that helps you with engagement with COVID. Thank you very much.
Fab, thank you so much for that. I think there are definitely some, obviously each group is entirely different and every individual is different, but there are some commonalities there. If people are accessing services where they know they're not going to be judged, they're more likely to open up and develop trust in that service, and you're far more likely to get a positive outcome as well. I'm conscious that we're very near 3 o'clock rather. I'll come back in time, don't worry. We have some time for questions and answers now. I know certainly the speakers on the call are able to stick around for another kind of 10 to 15 minutes. So we'll get started in the Q&A session now. And I know that lots of people will have other meetings at 3. So thank you very much for attending. If you have, for coming along to that as well. If you have to pop off at 3 o'clock, that's absolutely fine. But we'll be here for the next 10 or 15 minutes answering questions if anyone wants to discuss, or even any comments or thoughts as well. My colleague Sammy has been diligently checking the chat for questions. Sammy, do you want to just read out some of the questions we've had during the talks?
Yes, sure. There's been lots. There've been lots of comments. We received one earlier for Charlotte, which may need some clarifying, but it said, are there any plans to address literacy, especially digital literacy, moving forward? Charlotte's there.
So moving forward with the in respect to literacy, digital literacy, we are going to run with the 10 MiFi boxes that we've managed to secure. We're going to run like a bit of trial and error and see of the outcomes, and obviously use them to try and work towards securing more Wi-Fi or easier Wi-Fi access for Gypsies and Travellers on site. And literacy, I mean, we just work on the needs of the Gypsies and Travellers. We do support with literacy. We run weekly classes. We have a teacher employed at Leeds Gate who runs weekly classes to members that want to learn to read and write if they're low literacy level. Also, we don't run alternative education for Gypsies and Travellers, but we do work with them to find an alternative route to education if that's what they want. So it's just about working with Gypsies and Travellers about what they want and how we can best support them. We do have weekly groups that can support literacy, but it's, you know, it's all on it's all towards working with Gypsies and Travellers and what they want. So we can put things in place that they want. We can also give them choices, support them to access college courses, further education courses. Like I say, we have a teacher that we've got available on a weekly basis that's available for all our members. So I hope that answers your question.
That's really helpful.
So, Sarah, can I just say that at Cambridgeshire Gypsy Traveller health team, we have an adult literacy team that we do one-to-one adult literacy with our clients, working on health literacy, but also recognising that all levels of literacy will help improve health outcomes. And we do vocational literacy as well. So I think in different pockets around the country, it's being recognised and being addressed, but it's not a national thing.
I think it is that, isn't it? Both people having the support they want to access education, if that is their wishes, but also then I think building upon the work of the Accessible Information Standard, which for health and care services, that all information should be accessible to people, for example, with disabilities. A lot of the progress that was made there is actually, a lot of it's quite applicable in terms of making things accessible to people with low literacy. I know certainly we ourselves recently have put a tool on our website called Browse Aloud, and so it allows people to recite the content of the page for people, and also then you can have it translated into different languages, and it's quite affordable, and it can have quite a major impact. Of course, it doesn't take away from the fact that if people are struggling with digital inclusion as well, then there are other ways you need to be supporting people also, with that kind of two-pronged approach, that every service should be accessible from the get-go, but also people should be supported with lifelong learning, especially where there's been inequalities within education, or lack of not as much support in the education system, for example. Sammy, do you have another question you want to put forward there? Thank you for that, Charlotte, and to Shani also.
Yes, let me just get it. So this one kind of, I think other participants tried to answer. So someone asked, has anyone translated info for COVID-19 on test, track and trace, in particular for Czech and Slovak? And they said that they've produced info to date, but struggling to keep up as guidance changes, which I think may be more skewed towards Mihai. If there's any kind of recommendations or any kind of inclusion health groups that have language barriers in terms of accessing COVID-19 info.
Thank you. As far as I'm aware, there is no information at the moment on the taste and trace specifically that is accessible for the Roma. Now, we are trying to develop some resources, but as we have quite limited resources, it's pretty difficult for us to keep up with all the changes and with all the new information. We have tried to work with Kevin's office teams, communication teams, to sort of developed a Roma multimedia toolkit that would include the test and trace information, but this has not been released yet, and I am not sure what will happen, to be honest, with that. What I would suggest to anyone who is interested to reach out to these communities is to identify people in that area who could support with translating, interpreting this information and disseminating it in the same time. But bear in mind that, for example, you might have a Slovak Roma who is, let's say, a delivery driver who struggles to, ensure food for his family, will not have time to do such things. He will be willing to do it, but this means that his time might be resolved. So I've seen quite a lot of situations when services are putting a pressure on people like these guys to help them, reach out to the Roma communities, and it's not fair to them to do that.
Thank you. And then I think, so this one is for Jason and Kat. Specifically, have you got any advice about how we can reach communities of sex workers to understand support required in our local areas? For example, what has been successful elsewhere? I'm aware that in your presentation you mentioned about signposting, obviously to build on trust and already established trust. But I guess what the question's kind of looking for is for something that is a quicker win, I suppose, for individual organisations who can reach out and see how they can support them.
Kat, shall I jump in my take on this and you go in a sec?
Go for it.
All right, sure. It sounds like from what you're saying in the question, it looks like organisations are trying to put in a few points of recommendations to be able to support sex workers. Again, as you say, quick wins. I would say that it's really important that signposting is one of those quick tips, though, because if an organisation tries to put together even quick, short things for sex workers, one of the key components is that sex worker is then tied into a wider, more direct community, which has got peer engagement. So actually getting them involved with people around them is actually a really helpful component. So I would say there are some things that you can do as an organisation, but it's really important to look at why signposting is a barrier. And I mean, there's things like kind of tying in one of the questions that was earlier, like there's already a group called Crosstalk, which is specifically helping sex workers with digital literacy. If it's an area which is already happening, make sure you're not overlapping with an organisation that's doing that well, and see if you can sort of optimise the support for the communities. And that's my thought on it. Yeah.
Yeah, really quickly, was the question, so sorry, was that about the signposting, or was that about how to actually get more interaction with the community?
I think it was a kind of how to get more interaction, because yeah, so it says how we can reach communities of sex workers to understand support required in our local areas.
Yeah, I think I will do this super quickly, but I think some of the biggest things on this are probably engaging with the community and showing what you can offer that community and where you stand on things like, you have to be very honest. If you're working with the police, that's going to build a huge barrier. In some areas, that's an issue. You do need to be quite clear on that, and just trying to get the message out of what you can offer, who you can offer it to, and kind of being inclusive of the whole sex work community, and just targeting it at sex workers, not just randomly, really, because they can be hard to find.
That's really helpful, thank you. And then if we just, I think if we just round off now, just have one last question. There's one that I noticed in the chat that was, we've learned from Black and minority ethnic communities that the challenges are much more broader. Health inequalities mentioned is made in wider socioeconomic factors, structural racism, discrimination, distrust and mistrust. Are we also hearing the same from communities we have heard from? And I wondered, perhaps Ella and maybe Mihai, if you had some responses to that.
Well, I guess I could sort of give it's quite a difficult question to answer, but in terms of, I guess, looking at the needs assessment, what needs assessment taught us that if you face exclusion, if exclusion from services is something that is a routine, something that you routinely experience, regardless of which group of excluded group you might identify with or belong to, your experience of coronavirus will be more extreme. Whether that's, and often it's because there are a lot of cross-cutting themes around poverty, which means that if you don't have, like, if you just take the example of social isolation, or if you have to isolate for 2 weeks and you've got no mobile phone data, that's you inside with no contact with anybody and so that was something that was referenced from almost every participant that we spoke to as part of the needs assessment. So although like Public Health England have recently released their piece around the impact of COVID on Black minority ethnic groups in terms of having worse mortality if COVID-19 is contracted, particularly with like the Bangladeshi community. And similarly, Migration Exchange did a piece of work looking at what does your immigration status mean for your experience of COVID. So it's not necessarily your ethnicity, but your immigration status, which of course impacts, it's not just Black and minority ethnic people, but there are so many cross-cutting. And I think one of the worries was that when the Public Health England report was released, it almost made it seem like, it's a question like why are Black minority ethnic people more likely to have a more adverse outcome as a result of COVID-19? which sort of overlooks the health inequalities that that group already experiences. Though, you know, perhaps what is it about this group that is meaning that, you know, it's sort of almost very non-committal in terms of joining up the dots. And I think what Dots of the World did with our needs assessment is we didn't really help with that. We didn't join up the dot because the groups that we surveyed and we spoke to were so broad. So yeah, I know that that's probably not the most direct answer to that question, but I would say that things like digital exclusion and poverty as an overarching issue that were experienced by all groups that we spoke to came out strongest in terms of what made the pandemic harder to endure for these groups.
Thank you, Ella. And Mihai, did you want to add anything to that at all?
Well, I think this is something that we have experienced as well, due to obviously the lack of access to information using, you know, the mainstream sort of sources. You know, the digital exclusion that has strongly impacted on people's abilities to you know, to go through the crisis. You know, we had people who had absolutely no information regarding the COVID-19, you know, from the first place, and this had exposed them to the virus itself. So people who could not access, you know, the support available, and this has put them in extreme, you know, like poverty situations. So people who are already poor, who are already struggling, you know, with their rents, with securing, you know, the day-to-day life and so on, working really long hours. So people who usually don't engage with, you know, have never been on benefits before, for example, have never asked for support from charities. Those people were hit hard because they were not put on the furlough list by their companies. They could not access the self-employment income support scheme, and they could not access also the universal credit because they just didn't know about it, and they had no support to do that.
Thank you, Mihai. I think Ellie's kind of hit the nail on the head a bit as well in the chat. So Ellie said, I think that you've all been very clear about the exclusion from health services. And I can see that many of these are based on previous exclusion, possibly from education or ability to access economic support. These can be addressed within the health sector, but it needs to go right back to the previous inequalities. And I guess it's that thing that there's no real surprise that all the groups represented on this call have experienced really significant difficulties throughout coronavirus. The way that society is organised and the systems that benefit many also are unfair on other groups also. And it really does come back to those wider issues. And I think part of what we can do, either as charities or health organisations, is to stick our nose in a bit more in decisions being made across other areas of government where health inequalities are created through policies that aren't fair or through poor distribution of resources. And I think in a way it's become really clear during coronavirus the importance of like healthy living spaces and access to the tools that can protect and prevent vulnerability also. So I think yeah, I think that's us for today. I know Sammy has popped into the chat a feedback form, and we're going to email that out after the event as well. And I'll ask each of the speakers. I know there were some questions, particularly about the report from Doctors of the World and a few other pieces of resources. So I'll ask the speakers just to send over anything they'd like us to pop out to you. Also, thank you to everyone who's attended today for your questions, for your engagement. I can see lots of people are doing lots of really positive work on the ground just from the conversation in the chat. And just a big thank you as well to your speakers. I certainly learned a lot today. So thank you for each of your talks. They were really useful and really interesting. So I think that's us. That's done for today. I hope you'll have a lovely afternoon. And we hope to see you in another meeting, I'm sure. Bye-bye.
Thank you.